Zaka is putting out for us. Let me now introduce Dr. Mufazzal Lakdawala on the show, one of Mumbai's best-known laparoscopic GI surgeons, who is volunteering right now with the BMC to set up quarantine centers across the city. Jumbo facilities, really. Dr. Lakdawala, thank you very much for being part of this broadcast. Good evening to you and Eid Mubarak to you as well. It's good of you to have taken time off from Eid celebrations to come and join us on the show. My question to you is this. Mumbai is one of India's richest cities. Why has it emerged as its sickest? What has gone wrong according to your estimation?
Eid Mubarak to everybody, and it's not the best Eids that I have celebrated in my lifetime, that I can tell you. However, there are no holidays, there are no free lunches during this corona war. We are all in the midst of it, and hopefully we'll emerge victorious. Like you said, Mumbai, like any other major city in the world, New York, Moscow, Sao Paulo, they are the worst hit because they've got the maximum number of foreign tourists who've come in. They've got the maximum number of people, population density per land area. For if you, example, were to compare Delhi versus Mumbai, because it's probably got the last number of people coming in, Mumbai unfortunately has got a larger population of slums. It's got a lesser landlocked area. It's sea-locked from all sides, so you can't really expand. And that's where I think the problems are. In terms of recovery rates, I can tell you because I'm managing this facility, despite the ICMR guidelines, we unfortunately can't discharge all our patients on the 10th day. The only reason is because they share common bathrooms. We don't know what is the infectivity rate yet with these patients who are going out, and most of them beg to stay back in the facility for fear of transmitting it to their older parents or the young kids at home. So out of humanitarian reasons, we have to keep them back, and that's why you're seeing a slower recovery rate in Mumbai compared to Delhi. We've got a larger base of people as compared to Delhi or Chennai, for example. We've already have over 30,000 patients. So that's why our growth rate is increasing at, let's say, 6%, like you said before.
But, you know, if you compare Mumbai's death rate, Maharashtra's death rate really, to the All India average, the All India average is 3.2%. Maharashtra's percentage is 3.2%, and the national average is 2.9%, which means more people are dying in Mumbai than any other part of the country. It's not the highest. You know, West Bengal is the highest, Meghalaya is the highest, but it's fairly high.
I agree. We need to do much better because it's one of the best medical systems in the country. So we definitely need to do much better on that front. However, having said that, we do need to realize is that now we are probably in the middle of our peak. And that's where the problems are, that we are still on the rise, but we are probably in the middle zone. So we are getting patients who are coming out after 10 days when already the cyclonic storm has set in and cytokine storm has set in, and they're much worse than what we used to see before. We used to see a lot more asymptomatic or mild to moderate symptomatic patients. However, now people who are coming out of home are already breathless with low oxygen saturations, and as we are preparing to get more ICUs in place, as we are preparing to get more public partnerships in place with the private players, that's the big challenge that remains for Mumbai.
Would you say that the Maharashtra government and the BMC have been caught napping? I'll tell you why I asked you this question. The fact is that if you take a look at, you know, the ICMR team that had come to Mumbai, the projected numbers for end of May was 75,000. That Mumbai's peak will be 75,000. You're saying we are in the middle of the peak. And if you compare it to the numbers that the ICMR had given out, 75,000, then many would say that Mumbai has done fairly well by, you know, containing it to just 30,000. But if there was a projected peak of 75,000 by the end of May, shouldn't the medical infrastructure should have kept up? Why is Mumbai thinking of adding more ICUs now, or for example adding more beds now? This should have happened 2 months ago, 3 months ago. We all knew what was coming.
Yeah, so these projected figures, like you just said, ICMR team had projected 75. 2 ICMR teams have been here, and they projected much higher numbers than what Mumbai has actually got right now on board. At least the tested numbers are much, much lower. I do understand that best infrastructures in the world, New York, for example, has been caught napping. If you were to say they've been caught napping. Actually, that's not true. Best medical infrastructures have to keep pace. We don't have readily available ventilators. We don't really have high flow nasal oxygen masks. So we are really trying to ramp up the jumbo facilities. And I can tell you that we are stepping up to having 5,000 ventilator beds within the next 15 days. The problem is when you set up these jumbo facilities, everything takes time. How do you get in ventilators? Because they're not readily available. How do you get in the staff? And all that. So it's a race against time. They're up to the speed. Because I'm involved with them, I do know that they're working more than 24 hours a day to try and keep up. However, the number of cases is just far overloading the system. And it's impossible for any city in the world to be well prepared for such kind of a pandemic.
I agree, but you know, given that we had seen Italy, what happened in Italy, we had the lessons that were coming to us from Spain, we had the lessons that were coming to us from New York. Many will say we should have been better prepared. Right now, look at the number of beds that a city like Mumbai has. A population of 2 crores, only 4,000 beds. ICU under 700. We could have done better.
I think this is a problem which has gone on for ages and ages, that the healthcare, the government healthcare or something has been struggling to catch up pace with the private healthcare for many years now. So I think this is a problem which is a perennial problem. So right now, to be faced with such an avalanche of numbers, it's a little difficult to, so you can't necessarily blame the current guys for the problems that have been existing for the last 10 odd years, right? So what they are doing right now is what we can hold them accountable for. I think right now they're trying to do the best to make everything available. Funds are available. Whatever you want in terms of ventilators or high flow, whatever has been recommended by the doctors, they're doing that. So I think on their behalf, they're trying their best. If you took a model of New York or let's say Spain or for example Italy, actually India has done brilliantly compared to the number of deaths they've been having. So I think maybe we've had inherent immunity protecting us. My main fear right now is that the healthcare systems of the city are bursting at the seams. What happens when this goes to the villages? And that's where we need to fear about.
You know, since you're involved with the Maharashtra government in setting up these jumbo facilities, I'd like to ask you within the next 10 days or 15 days, what is the number of beds going to be as far as quarantine/isolation facilities are concerned, as far as ICUs are concerned? Do we have a figure? Are you working towards a goal?
We're looking at around 20,000 beds, and that's probably the best that we'll be able to do, given everything. If you put in all cards on board, on the deck, you'll still be able to do around 20,000 odd beds. In terms of ICU beds, we are trying to ramp up to around 4,500 to 5,000 odd beds. ICU, HCU all combined. What we've noticed is that the sooner we are putting people on, and ventilators might be a little less, but however we've noticed that world over the number of people doing well on ventilators is minuscule. So let's hope that the HDU beds and the ICU beds and everything that's ramped up will hope dampen the effect of this epidemic on Mumbai eventually.
You know, before I let you go, Dr. Lakdawala, my last question to you. Whenever you ask the Maharashtra government about the number of cases in Maharashtra, specifically in Mumbai, the standard answer you get is, we are testing more, which is why we have more positive cases. Is that something you buy? Or do you feel there has been limited community transfer? Not just cluster transmissions, but community transfer as well.
The problem with this disease is its infectivity. Okay, coronavirus is more infective and less mortal. So though there is such mortality, the problem is that if you had a virus like a MERS or a SARS, you used to kill people instantly and people used to die, and that was the end of infectivity. Unfortunately, in this case, an absolutely normal asymptomatic patient is transferring it. And in slum pockets where there are 10 people staying in a small 10 by 10 feet room, it's impossible for anyone to prevent this community spread. However, having said that, what we do need to realize is Mumbai started with a larger base of testing. When we started, we were probably the first testers and the largest number of tests having done. Though we might be lesser in number of testing right now, the problem is that how many people do you test? Because people in clusters and clusters are locked down. Now, when they're locked down, it's very difficult to get into these clusters and get people out. So what we are doing in terms of mass surveillance is we are doing X-ray screenings. And that's probably the second best tool we have besides the SARS, besides the nasal testing of the N coronavirus. What we are doing right now is whoever tests positive on X-rays, we send mobile vans out and various other things. So it's just not thermal screening or just no oxygen saturations. We're doing X-ray screenings, we're bringing them out and we are putting them into quarantine zones. So the infectivity rates, for example, will drop. Like for example, G South Ward, That was one of the largest centers and one of the first centers in Mumbai. But today, its growth rate has dropped down to 21 days. So that's what we are trying to do in the rest of the wards in Mumbai.
All right. Dr. Lakdawala, thank you very much for joining us. Thanks very much for your time. We are putting that chat up on our website, news18.com as well. A quick break here on the show. There's more coming up on the other side. It was day one of flights resuming in India, and there was confusion all around. We are getting you up to speed with that. Do stay with us.